Well, welcome to Wait, Don't Cut. And I am Dr. Narda Robinson, founder and CEO of Curacor Vet and Curacor Med. I am an osteopathic physician and a veterinarian. And I want to talk to you today about the kind of the client dialogue that we can have as veterinarians about whether or not to pursue surgery or just at least to empower them in terms of when they have an animal that might have spinal cord injury or cruciate issues or anything else, that there are principles that we can instill in them and information that we can provide that helps them make the information with you as their clinician, doctor, veterinarian, so that they don't just, if they are going to go for referral, that they aren't just feeling helpless when they go. So, for those of you that are animal caregivers, parents, owners, however you want to talk about it, this is directed towards you because I have other webinars that you'll see on YouTube and our website, curacord.org/vet, that go more in depth in the two main topics that I'm going to be covering, which is cranial cruciate issues and intervertebral disc disease. Next week on our webinar, I will have a more student-directed approach to spinal cord physiology. So there's just different audiences that we engage with, whether they're veterinarians, and of course we have Curacor Med, which is physicians and human healthcare practitioners, and then just everyday people that need more information because they are trying to navigate this emotionally charged field of veterinary medicine. And so I want them to have their best chance. And for our community of graduates from medical acupuncture for veterinarians or any of our other programs, rehab, et cetera, I want this to be a resource for you if you care to direct your clients to it on YouTube, for you to educate them some about at least a philosophy and optional kind of paradigm, how we are viewing these conditions that animals get, and that there is no need for rushing into surgery. So, wait, don't cut. I'm Narda Robinson, DO, DVM, MS, and fellow of the American Academy of Medical Acupuncture. So, our goal for today is empowerment. Reduce your fear. So this I'm talking to people that have their own animals, that you have questions about something's going on, and we're going to target surgeries. We're going to target especially cruciate injury or suspected cruciate injury, as well as disc disease or spinal cord injury. And so for you, my goal for you is to be empowered. That is to reduce your fear of questioning surgeons' recommendations. Maybe you are just hook, line, and sinker interested in getting surgery for your animal, but maybe you have never had the opportunity to feel like there's something else out there. For clients, our goal for you today is empowerment, to reduce your fear of questioning surgeons' recommendations, because it can be scary and you can feel helpless and you can feel powerless when you are in there and you're in a big office and just the collective mindset is, yes, for dogs that are lame, then that's cruciate injury till proven otherwise, and gold standard is TPLO, they will say, until proven otherwise, and you might as well start saving for the other cruciate because that's going to blow too, is the standard line. And I have something different to offer and to teach and to recommend. So we want to raise your awareness about non-surgical options. Part of that is you can tune into any of my webinars on YouTube on our Curacor Vet YouTube channel. But another way is, as I have here, you can go online, go to pubmed.gov, pubmed.gov, G-O-V, and put in search terms, even if you said TPLO, which is of course going to be dog, and you said risks, so that you can find literature that talks about this. Now, some of these will be free full text, so open online access. On the left side of that screen that you'll draw up with pubmed.gov, you can just select articles that will have free full text. And then you can read that. And And if you don't understand it all, you could maybe talk to your vet and see what the literature actually says, because there is inadequate information to defend what I have seen as the surgeon's very adamant recommendations that you need spinal surgery or you need knee stifle surgery when things go wrong. So if we ask them to produce evidence, then it's a whole other story. And I mean, I've been dealing with this for decades. And if you look on Veterinary Practice News or just online, just say NARDA and TPLO. So I'm the anti TPLO queen of the planet. And I just think it's way too invasive a surgery and that we have better options. And we'll talk about that more. But I have frequently invited surgeons to debate me, to sit around a table with me. Let's talk about the science and let's talk about the evidence. I have science for you about scientific integrative medicine, that's why it's called scientific, and also integrative rehabilitation. What's your science that says that TPLO or TTA is so over and above anything else for an approach? So for clients that are interested, the more you know, the more you will be able to ask informed questions. And if your surgeon doesn't want to hear anything about your questions, then you might need to get another opinion, or maybe surgery isn't the way forward because there is a lot to do that is non-surgical, especially when it's not an emergency. And then I will talk to you about finding integrated medicine and rehab providers that are graduates of our program at CuraCore Vet, and so that you can talk to them as well and see what their opinion would be. So, as I've said, our videos of past webinars and this one, all our Wednesday webinars, you can find them on curacore.org/vet, where we have the webinar section, but you can also subscribe to our channel on YouTube. For some of these webinars, I'm also putting them on our monthly podcast, Surviving Veterinary Medicine. And that is available on Stitcher, Apple, Google, SoundCloud, etc. I think wherever you get your podcasts. If you want more information, because we cover a lot of different topics in depth. So when is surgery necessary? And which surgeons will tell you? Big question. And it is not set in stone. And in veterinary medicine, we don't have enough evidence to give a solid answer. Even in human medicine, as you'll see, there is lots of room for debate, which means that you need to consider what your options are, not only based on what the surgeon tells you. So looking at the human field and the uneven terrain of even orthopedic surgery there. This is a 2017 article, not the last word. Unnecessary surgery can never be done well. And they're talking about, for example, knee replacements. So knee replacements in patients under the age of 55 with only mild osteoarthritis on radiographs is an operation that is evidently performed with some frequency, meaning too many times. And as they go on, because unnecessary surgery, implying that all these other surgeries for the 55-year-olds with really hardly any evidence of osteoarthritis, because this unnecessary surgery can never be done well, the focus of research must shift from examining how to perform surgery to examining who should really undergo surgery. So you can see, even though human medicine is so often more well-researched, advanced, debated, all these things, that it is far from a settled question about who should get surgery and when. And then as a commentary to this letter or piece, this other individual who's an orthopedic surgeon and vice chairman of orthopedics at Montefiore Medical Center said the literature describes an epidemic of overdiagnosis and overtreatment. And the treatment of individuals with low back pain, for example, is a poster child for excessive care. So here brings in this piece about spinal cord, spinal injury, disc disease, back pain, neck pain in our small animals. Again, because it's not even settled. And why isn't it for humans? Who is calling the shots? This is always the recurring question. Who is setting the gold standard? Who is setting standard of care? And really, there is no one set standard. At least, you can think of the United States, North America in general, Canada, Mexico, I suppose, too. But I think the AVMA more goes with USA and Canada. But anyway, So it matters what the people around you in your community are doing. That is more what decides standard of care. So that even brings up questions like, well, what's the best? Is this just because this is a population, people get a vote on it, you got a big surgery center, and so it's going to be surgery heavy, the standard of care? Shouldn't this be based on the evidence and best practices? Anyway, Levin continues, maybe it is time that we critically analyze how we are caring for the public and identify better strategies. Despite spending more per capita than any other kind of well-developed country, our quality of care pales in comparison to almost all of these countries. So what is driving this? I suggest that we redirect our efforts and focus on the welfare of patients and the primacy of patient care. This philosophical change of advocating for our patients will ultimately be better for our patients and our professional satisfaction. So we see here conflicting views, and as you dig into even how human physicians, human surgeons are feeling about what's going on and what forces are driving all this excess surgery, then we can think of, well, how does that filter down? What is that reflecting on with veterinary medicine? And who's pushing back and why? He continues, to maintain efficiency, we perform a physician-centric encounter. Is that what you do for the vets here? Is that what you are doing in your veterinary practice? Is this all about the practitioners, the veterinarians, and the business or the teaching hospital or whatever? I know I've been in situations where that was very much what it was. It was all about the business. It wasn't patient-centered. So here they go on brief evaluations with rapid recommendations on imaging and therapy. I think of orthopedic surgery centers for humans that I've been to, and it is quite assembly line. You go in, check in, go to the doctor, very brief. Let's go to imaging, let's go to therapy, especially when that center owns their MRI machine and their physical therapy. There used to be bigger restrictions on that, I believe, in terms of conflicts of interest, but who are we to say with veterinarians, because we sell food, we sell the drugs, we have it all as well, which has pros, but it also, has considerations. Anyways, Levin continues, we spend less time enjoying our visits. Does that sound familiar? Less time teaching our patients. And we want to avoid adversarial encounters by complying with requests for imaging. Hey, doc, I want an x-ray, I want an MRI. Therapy, you got to send me to physical therapy. And pain medication, I'd like 30 OxyContin with 2 refills, please. So there's so many forces, the pharmaceutical industry, the insurance companies, various other private pay entities, Medicare, so many things. In the patient-centric encounter, we enjoy meeting our patients. The patient has sufficient time to explain his or her problem, and we spend the necessary time to examine our patient and adequately discuss treatment strategies. So, I'm so old that I remember when people had their own practices. I've had my own practices. And you set your own guidelines, but apparently that has changed. So again, when we flip to veterinary medicine, we're going to think about intervertebral disc disease and spinal cord injury, and what is the go-to approach to that? And considering what are veterinary schools teaching? And yeah, are they teaching photomedicine and medical acupuncture and rehab as first-line care? No. Are they typically way above average, in my experience, teaching, yeah, don't do that, or don't do it for a long time, and you need to confine that animal to a small cage and for weeks and weeks and weeks, only go to the bathroom. And so that's the opportunity. So for clients and vet students here, where we should be saying, well, why do you say that? And so for those of you that have been conditioned to expect that we're going to have strict confinement, where is the evidence for that? There is none. So if you instead of a situation where there is controlled activity, that makes sense. But there are wrong outcomes that happen with strict confinement anyways. But think about just the mental impact. And when your spinal cord is injured and there's been neurologic discommunication or dysfunction, disconnection, then the rewiring and the recommunication channels that happen need to have appropriate movement and conditioning to make that rewiring circuitry fire in a useful, functional way. Some people say nerves that fire together wire together, which causes us to consider in the integrative scientific world about medical acupuncture and movement and rehab, just thinking, how do we make the body, how do we encourage it to fire in a healthful way, rather than how we see from these long periods of strict confinement, animals losing their ability to be coordinated, they lose their strength. If they're not weight bearing appropriately, their joints degenerate because it's weight bearing that causes the good nourishment, the good nutritional supply to the joint surfaces. So it's very important not to do that. It's important to control their activity as well. But we are currently in the midst of this paradigm shift where we have the old guard who was so much more reflexive into surgery or high dose steroids and strict confinement, and that's it. And don't do anything else, and those rehabbers will hurt you, or in acupuncture's wacko, and all these other things. Whereas now, we are informed and we know that acupuncture is neurophysiologic based on neuroanatomic principles and connective tissue changes that allow fascial easing and allow better restoration of communication between cells, between sheets of fascia, between muscle groups, and so on. So there's so much more to do. There's so much more with an integrative rehab approach than just doing modalities of thinking you're a physical therapist, but by actually reasoning through and dealing with that sensory motor integration that we want to restore. So for clients, realize that part of why I'm doing this is that you are subject to receiving information based on who you happen to be near geographically, who you happen to call for an appointment, what they say to you, what their experiences were, where did they go to school. Because even among neurosurgeons in veterinary medicine, the approaches are not standardized. You could go to Colorado State University, and depending on what faculty member you encounter, at which stage of faculty development, at which decade you happen to go in there. I mean, just my experiences teaching at CSU for 20 years, it varied extremely widely from when I was a student to in 2016 when I had left to start teaching more with human medicine. But that CSU versus Davis versus Penn, wide differences. So if it was all based on evidence and rigorous standards and best practices, you wouldn't see such wide variability, but it's not. It's very, very subjective. So anyways, what's happening in human back surgery so that we can get some understanding of what are our brothers and sisters doing, or my colleagues, whatever, seeing over there. And so the types of topics that I tend to cover in these webinars can be slightly edgy, and people just generally don't talk about it, just what I'm doing today. So I really get a kick out of seeing other people that will push back and speak their truths and counter prevailing mindsets, especially when there's not necessarily the highest ideals in play. So you can find this too on YouTube, called License to Harm, a surgeon's whistleblower expose on surgery and medical care. Really good video to watch. He's an orthopedic spine surgeon for over 40 years, formerly taught at University of Miami Medical School. And as they say in the video, one topic that is considered taboo, veterinarians probably relate, and is usually never discussed, is the integrity of surgeons. So, taboo to discuss the integrity of surgeons and how a patient decides who needs surgery, or how a doctor decides who needs surgery. Who is in charge here? So they ask in this dialogue, why would a surgeon perform a procedure that wasn't warranted? And so Dr. Nord responds, most surgeons are employed or want to make enough money to justify economically sustainable income. So for the veterinarians in the audience, is this something you have heard? Is this something you can resonate with? Why would a surgeon perform a procedure that wasn't warranted? We're talking about money immediately. And he says, it is money driven at this point in time. Has surgery become a business? This is another YouTube. So I'm just taking brief excerpts because that one was over 20 minutes. This is about 5-minute video. He says, in the current medical culture, revenue and expensive surgeries are a priority for corporate providers, and patients just become revenue and a product. Does that sound familiar? As the diagnostic and wellness aspect is neglected, healthcare becomes a business and a medical assembly line. And I include this because here I am, an osteopathic physician since the 80s and a veterinarian since the 90s, and I am an advocate for scientific integrated medicine, obviously. But here we have an orthopedic surgeon who has taught University of Miami, who's been a spine surgeon for 40 years or more, and he is himself questioning his colleagues. He says patients have the responsibility to question and query their caregivers. So do clients, and it can be scary. So I just want you to have this context so that you can understand that you are not alone. On the video, there are a couple of patients that talk about their experiences, and there's one who didn't want to have surgery. And he says, when I told the surgeon that I didn't want the surgery, it wasn't a nice situation. I got a feeling it just seemed like he was kind of mad that I didn't want it. And how many of you veterinarians that are on here or vet students during your career, how have you noticed the mood, the tenor, the information, the attitude change on the part of the caregivers when somebody said, no, I don't want to do that? And in my experience too, being at the university, it's like, well, what if they want to try acupuncture? What if they want to try rehab? How much effort had they had to push against a surgeon, a resident, whoever it was, in order to get their animals' needs met in the way they felt it was fit and it was effective. So anyway, he goes on, there seems to be a rush to judgment and a rush to operate. So think of the big TPLO centers in your area that are just, I know that one time I had called, did I call, or the client called in my presence because I just wanted a second opinion on this dog that I thought had a cruciate issue. And I thought, okay, if you feel like it, go to this orthopedic surgery center down south in Colorado and see what they say. And he called up and the receptionist answered and she said, so when do you want to schedule your surgery? And he's like, I just want an appointment. And they're already scheduling surgeries just when you call in for an appointment. So, and then usually when they go down, I mean, it's not unexpected to have them say, start saving for the other one because the other one will blow too. So, if there's a way that we can nourish tissue health, which there are ways, and if we can change the weight bearing parameters, if we change the strength, if we change the sensory motor tone that governs joint integrity and protects it, if we correct imbalances between the agonists and antagonists of the cruciate, if indeed that's what it was, and if we do a better job of diagnosing and we find out where is this problem really, and we're not going to spend an hour pushing that tibia back and forth to see is there a drawer or not, because there are so many other conditions that it can be. So if you want to know more about all that, that's in my tragic TPLO webinar that we did a few weeks ago. He continues, in some cases, doctors fail to diagnose correctly, which I was just talking about, in a rush to operate. And that can lead to improper diagnosis, which I think is fairly rampant in both veterinary and human medicine because of the shortening or elimination of the physical exam, the not even knowing how to do a myofascial palpation, and the lack of considering a broad differential diagnosis list and just having tunnel vision because you have 5 minutes. It's like, okay, cruciate, you have fleas or whatever, you have this or that. And people and their animals are falling through the cracks, and they're spending a lot of money on potentially injurious responses to a misdiagnosis. So to reform an opaque medical system, old school physicians, I would consider myself one, recommend transparency first. Patients get to the point where they lose hope and they lose control of their medical destiny. And that's another thing for you who are clients here, that don't lose control over your advocacy for your animal. Don't be bowled over so much that you are just acquiescing and you don't feel it's right. You have to feel it's right inside. And just see another veterinarian, get some other input, see an integrative medicine from a scientific perspective practitioner. Because I know when I've been in a position where I've surrendered to somebody else's it just doesn't turn out well. So then in the video, chronic low back pain couldn't get any relief. People wanted to do surgery on the back, got a lot of pressure for it. Dr. Nord, and he diagnosed because he has control over his own schedule, like I think that veterinarians should have over their. Right, again, where they lose hope, but describing a patient, like this, where it's actually shouldn't be something that you yourself is even if for your own problems. So the future depends on who's in charge. And as medicine begin to spread and spread, then veterinarians are less in creates a lot of problems. So anyway, he understands that speaking up may seem revolutionary, but it is necessary to save the soul of the medical profession and its essence. I would say the same for veterinary medicine. In corporate medicine, you're seeing patients every 6 to 8 minutes rather than giving patients time to tell their story. That's where we've lost the patient-doctor relationship. So what more can be done than is typically offered in human and veterinary medicine? Medical acupuncture, medical massage, photomedicine, and botanical medicine, just some features that relate to these approaches, mechanisms of action, integrate with conditions such as intervertebral disc disease and orthopedic surgery problems, such that we're matching mechanistically. So mechanism to mechanism. What is the mechanism of injury? What is the pathophysiology? And how can we repair that with these techniques and really nourish the body and really get the strength going rather than cutting? We're helping to repair, we're helping to protect. And in something like intervertebral disc disease, that can mean the difference between life and death. So the consequences of IVDD and spinal cord injury, SCI, can mean like they are a dog because drugs and surgery are not sufficient. For one, surgery spinal instability, especially when it's like, oh, there's a little bit of bulge here. Let's go ahead and take that let's do a hemilaminectomy on the one above and below. And you're just destabilizing the spine from a bony perspective, a ligamentous perspective, and muscle perspective, because you're not getting that proprioceptive protection that you would if things were intact. So there can be ways to address spinal cord injury. And of course, if there was a huge something or other spinal cord, which we don't always, I mean, that's big as whatever cord, or is there even anything? Was it a small piece dissolve and not cause problems? So I know a lot of veterinarians are like, well, how do I advise my patients? And I say, just give clients the information they need on how acupuncture related techniques and botanicals can help to work to improve spinal cord health and the recovery process. And that's again why next week, as we cover in depth the primary and secondary pathophysiology of spinal cord injury, when we continue our Untold Story series, especially for vet students who are in school and not getting the full story. So I'm helping fill in with the piece that I provide. So just be honest and be transparent. And here's the pros and cons of this approach. Here's the pros and cons. What's missing with drugs and surgery is the endogenous aspect, the endocannabinoid system that is not only from cannabis, electroactive massage, and other techniques. It's in the balance of endogenous opioid systems. Soft tissue therapy that's going to work with the fascia and help restore an integrated structure. Neurorehabilitation, which includes all of those things: acupuncture, massage, laser therapy, and botanicals, but especially acupuncture. And so with dogs, and especially dachshunds, there's a risk of recurrence. So even after surgery, the rate of recurrence of neurologic signs and consequent euthanasia in dogs nears 50%. They just don't want to go through it again. They don't want to put their animal through it. And why was that? Was there a bad outcome? Was there problems urinating or defecating after surgery? Were they in a huge amount of pain? So, this idea that surgery is the gold standard, when you really look at it, it's like there are a lot of problems that happen with surgery. And we will see that still with when we talk about orthopedic surgery and cruciate problems. But even nervous system remains a leading cause of death and disability in individuals under the age of 50. Be COVID now, but with spinal cord injury, were these deaths preventable? So for animals as well, euthanasia, was that preventable? What do humans want? What do dogs need? Sufficient restored mobility, most advanced care of what? Would you want surgery if you had other options? Exercises to maintain some bladder function. So that's where we get to the, it can help the body, and it's part of the whole how we're made else to heal itself, but there needs ability to enough strength processes, and those, and we can describe how they work physiologically with acupuncture related techniques. So cure to protect to cure with spinal cord injury, because drugs don't do it, and the focus of research before was with drugs and surgery, but now it's going to neural regeneration and neuroprotection. And even that's where we bring in cannabis, and we bring in, again, what I've been talking about with the, so we match the mechanisms, we know the mechanisms, because we're not working metaphorically, we're not working with myths and all that metaphysics, but we can think of the whole patient. So there's the spinal cord issue, yes. Now this dog was post-surgical, but the whole body is affected. So we have pain locally, we have neuropathic pain. So I'm maybe getting a little too in depth for the clients in here, but let's just say there's a lot of different types of pain when the nervous system has been injured, and when a patient is not ambulatory or able to move around. A lot of inflammation, you can have internal organ problems, you can still have weakness or paralysis that needs some kind of attention. So even if you're cutting out things in the back, how are you going to restore the function of those nerves? You might have urinary and fecal incontinence. What are you going to do there? There's not much surgery that can restore that. Again, unless there was something big and pressing, and usually that's not the case. Usually there are ways, especially with thoracolumbar disc disease, so happening down here, where we can use acupuncture and such to help restore neural communication. But of course, you have to work this out with your vet. And so I'm not saying that's always the case. That has to be on a case-by-case basis. And I am not your physician or your veterinarian. So that's my disclaimer, is you need to work that out with your vet and the people that care for your animal. But anyways, there can be skin break, kinds of multi-system problems, ways to address those, and box and let them wither or go nuts. No surgery, of course not. It was, but we're bringing these procedures, they should become standard. That will help them get home sooner. It will help their ability to walk and regain walk, and just get, if we encourage them in the right manner. At some of the features of acute spinal cord injury and chronic spinal, something happened, not be able to use the legs, the limbs, for one reason or that happen in where the circulation is off. There's a lot of spasm of the vessels there. That was really traumatic, then you might lose some of those nerves in the spinal cord, the neurons. So you're getting not enough oxygen there, you're getting swelling, and you're getting just kind of a generalized lower blood pressure. But what happens after that initial injury, whatever it was, it's the long-standing part that comes after that that really causes the problems, and that's called the secondary injury phase of spinal cord injury, spinal cord pathophysiology. And that involves all kinds of things that are mediated or brought through the blood vessel system, and you're getting inflammatory factors being released, so some changes in the biochemistry, and that is going to be what determines the long-term morbidity or illness and ability to recover. So all the things you see here, this is more what we're going into next week, but it all points to issues that are changes in the physiology of the local spinal cord and all the nerves, which are areas specifically that we can help with acupuncture and photomedicine, which is laser for the most part, and some light emitting diodes, but more laser we're going to rely on for this with specific wavelengths, and we want depth of penetration. So all the things, again, that happen to destroy the ability of the animal, impede the ability of the neurons to recover, get all scarred, issues that. So here, just as my rough kind of neurons, these lines here, this is the cavity formation, spinal cord injury with some blood vessels having died off or whatever to reconnect. But if there's a big scar there, they can't. And even once they can, neurocircuitry is where, when I said neurons that fire together, wire together, they need to be encouraged to fire together so that they can. And that's again with movement, with medical acupuncture, we're causing stimulation to the nerves so that we don't get this jumbled chaos here. And that's what you see on these animals that have been confined for so long. They can't get it together. Impact of acupuncture for spinal cord injury has been around for a long time. And even back in 2001, talks about all kinds of different pain and neurogenic bladder and bowel function. So all the different things that I had posted there for the Dachshund that we have evidence and related techniques can help, which makes it so much of an imperative for whoever you dog gets injured. You need to savvy and knows the science of the evidence. And so if you would see a surgeon that would say, what are you doing delaying? You need to realize that there's nothing other than animal. Here are three on like a spate in the late on electroacupuncture and helping animals with disc disease. Because, oh well, this was a. If you look at the surgical studies, they are so. I was confronted New York vet one time, and there was a surgeon in the audience, because that's what will happen when I speak at meetings, is there'll be a surgeon or two that come just so they can debate me. That's surgeon. She was so mad with, and she said, we have randomized double-blind control studies in surgery, and what do you have? It's like, I know you do not have any randomized double-blind controlled surgery studies. You just double-blind placebo controlled surgery. It just doesn't happen. So when that really disclosed to me, she didn't know what she was talking about, because they just don't have those. With that spinal cord injury, what do we do with the pain? There's all those different types of back pain, neuropathic pain, and so on. This was from our video with little Cece, one of the first Dachshunds that I saw at CSU, where we brought in physical therapist Deanna Rogers to help with this. And this was after surgery. This was after decompressive hemilaminectomy, and she couldn't walk, she couldn't urinate. And she was at first, you can see the catheter bag there. She was at first very worried and wanted to bite a lot because of her experiences in the critical care unit. Insisted on having acupuncture and physical therapy, and that's what helped us start the physical therapy program at CSU. But here I'm just using some gentle massage. This is after she's recovered. She's grown back her hair, obviously, and she can walk, but I'm still assessing for myofascial restriction. I'm doing massage, I'm doing neurologic testing, and I'm doing acupuncture and laser. So this is what the alternative is. This dog would have been dead after surgery because she couldn't get up, she couldn't walk, she couldn't urinate. So many lives get saved with these techniques, and whether there is surgery or not, they are important to have as options, and they should be offered right from the get-go. And that we're identifying areas of tension, we're addressing things specifically, and not with woo-woo, not with chi-chi, this and that, with actually feeling with our hands, doing rational, good, gentle, caring, fear-free physical exams, and treating what we find appropriately. So massage has evidence for patients with spinal cord injury. Of course, we see pain, stress, and muscle soreness in dogs after back surgery. Why is massage not standard of care? Should be offered all the time. Photomedicine, here's little Buster and Eddie here. They came from many states away. They'd come for their treatments. But photomedicine is important, and it's shown to have significant effects on spinal cord injury. Should be standard of care across the board, first line treatment, all kinds of things in conjunction with other things. So this was a case, this was Charlie. Charlie would have been euthanized if he had not been referred to the acupuncture service because he got a death sentence from surgery. They told their dad that he had ascending, descending myelomalacia. So for clients that just serious, unrecoverable from spinal cord injury, and that he had no deep pain. And I found conscious perception of what I was doing with my acupuncture needles. So it was just yet another case where wouldn't be alive if hadn't gotten this kind of treatment. So it's why it's so important to know your resources, to know what can be done and where you can find help. And this was Charlie, again, who would have been dead. And yet there's probably some spinal walking, but he's at the clinic where I said, get thee to this clinic ASAP. And he'd spend the day there, and they would do all the kinds of integrative medicine treatments with him during the day. So saved his life and made such a huge difference in his parents' lives. And just to show the translational application, there's Cece again with her mom getting some therapy. And then we can talk about botanicals. It has to be done rationally, has to be done legally and safely. But another thing, another option for neuroprotection, neural recovery, neuropathic pain, and just multidisciplinary approaches. So but people need guidance. And so if you as clients are not getting guidance, it's out there. And if you need to contact me, it's narda@curacor.org. So integrative medicine and rehab can change the diagnosis because we're doing better physical diagnoses. We're spending more time. We're asking more questions. We're using our hands. We can help patients avoid surgery. We can give you your options, tell you the pros and cons of each, and you can make your informed decision. Can help renew hope, provide comfort, improve spinal cord health, restore functional mobility, and so on. So we take that information, and what else can we apply that to? Well, there's the whole host of orthopedic surgeries. So when I showed you the information about medically unnecessary or excessive surgeries in humans, that's in humans. And again, there's more written, there's more talked about, there's more people in that field. But the only one I could find, the only reference I found in veterinary was this review of medically unnecessary surgeries in dogs and cats from JAVMA 2016. And yeah, this is important to consider. And we're talking about tail docking, ear cropping, dew claw removal, phalangoectomies, ventriculocordectomies, defanging, all this stuff, which is important to talk about and think about what we should do as veterinarians. But that's not about cruciate injury and TPLOs. So let's look at the estimate of the annual economic impact of treatment of cranial cruciate ligament injury of dogs in the United States. And so this was a long article. I just took out this quote: rupture of the cranial cruciate ligament is a prevalent, costly surgery. And just looking through JAVMA and the debates about things, and yeah, it's like one of the most commonly diagnosed ailments in animals, and it's very costly to address, especially with these surgeries, TPLO, especially in TTA. And I just liked how there was this rebuttal here, this letter to the editor questioning this very pro-surgery article, because so many of the articles that surgeons publish are pro-surgery, and they might be like, oh, TPLO is better than TTA or this or that or the other one, but they're not. They are not comparing surgery to acupuncture, photomedicine in general. They are not doing that. And when I've seen an attempt with this one laser study, it's like you didn't even use the proper methodology to assess this. So anyway, here's the rebuttal. Of particular concern to us, dogs still demonstrated clear functional impairment after surgical correction with mean peak ventricular force 50% of body weight at a trot and 38% of body weight at a walk for both groups 12 months after surgery. And so this was comparing one surgical technique to another surgical technique. And that's what the surgeon authors respond to him. It's like, well, we're not comparing surgery to non-surgery. We're comparing surgery to surgery. But at the same time, this Dr. Moreau says such low peak ventricular forces are a hallmark of osteoarthritic lameness in dogs. So for the clients that are here, if the person who's evaluating your dog and saying you need to get X surgery, typically a TPLO, or you are immoral if you don't get your dog surgery right away because your dog is going to develop this horrible arthritis unless you go, and it's time is of the essence and you need to go right now and you need to start saving for the other leg. Realize that that is not true. And that's where I have the empowerment piece. It's like go to pubmed.gov, as I have people in my courses do, and I say, find me the evidence that says with surgery you will not get arthritis or as bad arthritis, because oftentimes you can get more arthritis and dysfunction and crazy secondary injuries and stuff like that. So anyway, he concludes, with these concerns in mind, the benefits of surgical correction for dogs with cranial cruciate ligament disease remain unclear, and that is the truth. There is a lot of unclarity, even though vet students, vets, surgeons have been conditioned to say, oh, surgery is the gold standard, oh, TPLO is the gold standard. So don't believe that your dog will have chronic pain for life without the TPLO, because that is not true. And here is a study by people out of Finland that I like reading their stuff a lot, but they said use of an owner questionnaire to evaluate long-term surgical outcomes and chronic pain after cranial cruciate ligament repair in dogs, 253 cases. And for those that say, well, it's a questionnaire of owners, their approach is like, well, these are people that live with them all the time. They can tell how they're doing. So there is reliability in that. And that they conclude, based on several pain-related questions, many more dogs than expected were found to have signs of chronic pain, a mean of 2.7 years after surgery, after cranial cruciate surgery. So years after, they're still having chronic pain. So again, why is it considered the gold standard? Is it really any better? You can see other papers that are saying, well, after about a year, they all come out the same. So why did you put all that metal into this animal that you can't retrieve and that's going to cause problems? And so when we say gold standard, oh, well, what kind of gold are we talking about and whom is it benefiting? We're talking about billions of dollars that is this injury. So just as an aside, remember we talked earlier for the human about how money is driving this. So whether it's a surgeon in private practice or a big corporate practice or big surgical network or whatever, let's be reasonable and say a TPLO is $6,000. And there are surgical practices that would do 5 a day. So there could be ones that do many more or a few less, but I think 5 is a reasonable and 6 is reasonable, 6,000. So $6,000 times 5 surgeries would be $30,000 a day. Now, if you do $30,000 a day times every day, even if it's not the same surgeon, if you have other surgeons in there and they're sharing, so that's $150,000 a week if the clinic offers surgery every day. And why I did this math myself is that you can find more information about statistics of earnings and everything in human medicine. I've looked and looked and looked. I've seen before that cruciate surgeries, TPLOs, are billions of dollars of business a year, but I can't find any primary research for that. And I think it's because people don't want the public to know. So anyways, you're making $150,000 a week because every day you're bringing in $30,000. That's $150,000 per week. And if we give people 2 weeks off, say $150,000 times 50 weeks is $7.5 million a year. That's for one practice where they are doing these 5 surgeries a day. So just in general ballpark. Now, if we say $7.5 million per surgeon or per surgery practice per year, I think that's a reasonable restrained number, times 1,000 board certified American College of Veterinary Surgery diplomats. So you have, at least what I had consulted was that there was like 22 or 2,400 boarded surgeons from 2019 or something, and that like 40-something% of those were small animal, general, and orthopedic surgeons. So I said, let's say we have 1,000 board certified surgeons that are taking in $7.5 million per year for small animal. That's $7.5 billion a year for this industry, and that's only talking about board certified surgeons. I mean, I'm just kind of bringing these figures together, but there are so many people that are doing TPLOs, taking a weekend course and doing it poorly, typically, as evidence shows. So you have a lot more surgeries than that. So how many billions of dollars are being spent annually on dog leg surgeries where they are doing such massive complications, such massive traumatic injury? And obviously, I am not a fan of this. And again, watch my video on the tragic TPLO. But then that's just for the surgery itself. What about when there are complications? Who pays for those? You do, or the client. And that's more revenue for the clinic too if you're going back there. So we're tacking it on. So who pays for the second surgery when an implant fails, or you need to remove it or something, or hardware, or something happens, something ruptures? You pay for that. Unless you want to cut the leg off, you're paying for that too. Unless you're going to pay for euthanasia, you're paying for that, and then you're regretful. Why is surgery not better scrutinized? Who is not afraid to speak out against the machismo of orthopedic surgery? I guess me, right? But you hear, oh, so and so doesn't like TPLO or this or that. They're never speaking out. So who's even learning about this? What clients are empowered to ask questions, to debate, to go somewhere else? We know in our scientific integrative medicine CuraCore community, we have so many people that are hiring other people because they're so busy they can't keep up because clients are finding them. But there needs to be so much more. This needs to be taught in school. Here's your tibial tuberosity advancement. How comfortable does that look? Ugh, that is crazy traumatic. So why are you not given options enough? Especially you're just being convinced that this is the gold standard. So what we want to do is encourage treatments that are going to stimulate the body to repair itself. We know that even in human medicine, there are no evidence-based arguments to recommend a systematic surgical reconstruction for their ACLs in the human. And knee stability can be improved not only by surgery, but also by neuromuscular rehabilitation. So integrative rehab, whatever the treatment, fully normal knee kinematics are not restored. So whoever says that TPLO dog knees are the same as they were is completely misled, because you cannot. You've changed the anatomy, you've changed the function, you've got all this swelling, and it's just, I just am not a fan. Again, what would you want if this was you? Would you want your tibia cut and then plated in a different position? I don't think so. What's that going to do to your back, to everything else? Again, watch my webinar. There's no reason to rush into surgery. You can do integrative medicine first, especially even more clear for the chronic situation that is cranial cruciate disease in dogs. Certainly, there are questions with disc disease, but there's so many animals that respond beautifully and relatively quickly to just integrative medicine and rehab. So we need to shift that mindset. We need to have more research, but there are definitely options, and you don't have to just have euthanasia or surgery as your only options, or real high dose steroids. So just the American College of Veterinary Surgeons, here's what they suggest is like indicating a cruciate. I think it's indicating a whole bunch of different things, not just a cruciate. I think that the medial buttress sign is a good sign. It's helping the body stabilize. It's helping to give you more surface there for the femur to lie on. And yet in this today's veterinary practice article, it says that you find a medial buttress and that provides ample indication for surgical joint exploration. Why? Even in the absence of cranial draw sign, I think this is just showing the mindset that's out there and how let's drive them. Let's rush to surgery. Let's rush, whether or not you're doing imaging. I mean, you can see that in the human medicine, as I started out with, and then drawn into the veterinary practice. But you have many options other than surgery. And so let's ask, how do they compare? When you go to consult a practitioner, let's say, how would acupuncture, manual therapy, massage, herbs, laser, would it ever cause this kind of an infection? Look at this bone plate here and this infection after the TPLO. The bone plate here with this biofilm, this resistant organism. The cost, this is a vet who she did not want a TPLO and she felt she was kind of pressured into it. And resistant bacteria, her dog was hospitalized with wound suction for 9 days in the ICU. The wound was kept open through till mid-September. Her cost for that TPLO was $18,000, and the dog had resistant organism. The only thing susceptible was amikacin. And she talked to the microbiologist at this university center, And microbiologist said, surgeons can't expect to do that much manipulation to tissue without a significant risk of infection. And then she asked, what is the true rate of surgical infection? It isn't that few percent that is reported. So underreporting, when she was having this dog post-surgically and seeing all this swelling and redness and heat, being told, oh, you must have let him move around too much. So that must be it, until she brought him in and they found this problem and they put him on the ICU floor there with that amikacin drip. And as she had the realization herself, so for clients out there, vets get hammered too. Vets get just kind of intimidated as well by surgeons and this prevailing kind of structure and mindset and groupthink. She said, I know I have told people that when a TPLO goes bad, it goes really bad. I don't think I could have imagined what my dog went through. And reflections later on her own practice, she said, I did have an old client reach out recently for an acupuncture consultation with a dog that was 3-legged, 35 pounds, not a big dog. And you're carving up little dog legs as well, and even cats getting TPLO. I think that's just so abysmal. And when she asked what happened to his leg, they said he lost it from complications for TPLO, fracture, infection, then amputation. How much did that cost to lose your dog's leg, who I know should never have gotten a TPLO? Again, they were not prepared either. All that pain, expense, trauma, and exhaustion, and not prepared, not offered non-surgical alternatives. So think what that does to the clients, to the animal, to the vet, to our profession when we're pushing something that is so tragically flawed. And here she is heading back to the university for removal of the bone plate with her dog there and suffering those consequences. Here's 1 year later, all that atrophy. This is that huge surgical scar. He wouldn't even allow anything to touch it. She couldn't even do laser therapy with him because he was so neuropathically wound up for good. Maybe a ZZ loop or, electromagnetic field loop there if it wasn't touching, but it was so painful still. And then there's this cancer. When I started to write about cancer and TPLO, even from my own colleagues locally, I got all this pushback. Oh, it's just a case here and there. It's nothing. You're making too much of it. Surgeons gave me a lot of pushback. Oh, osteosarcoma. Oh, it's just here and there. Maybe it would have happened anyways. Oh, now in 2014, there's 29 cases. Okay. Oh, 2018, association of the tibial plateau leveling with proximal tibial osteosarcoma in dogs. Oh, you mean it's really a thing? That there's 40 times higher risk of osteosarcoma in dogs when you do a TPLO. How many of our clients, how many of you clients have been told all the risks that you're putting your animal up against with this kind of surgery? Or is anybody telling you about this even? Corrosion and ion released from these plates, perioperative problems. And again, we're kind of out of time, so I won't go into this. We talked about it more in the tragic TPLO, but there's just so many things, bad things that happen, bad, expensive, painful, damaging lifetime problems that happen with the TPLO. And who knows what the real risk of that is, but even if they come out supposedly well, the way I've seen surgeons say, oh, that dog looks really good. I mean, their limb is not moving normally. If their limb isn't moving normally, their whole back is not moving normally. Did they have an adequate neurological exam? Are they suffering from neurologic complications as well as the TPLO? And what are they destined for in terms of chronic pain, patellar tendon thickening, all kinds of things? So why not try non-invasive options first? There is no harm in that. No harm in that. If you have a solid practitioner, which is who we train. Photo medicine goes through, again, mechanistically, like with the intervertebral disc disease and spinal cord injury, we're meeting problems, we're meeting disease with mechanisms that heal it. The inflammatory process, the edema, the tissue breakdown, we're improving circulation, endurance, comfort, joint mechanics, balance, strength, sensory motor integration, reducing pain, supporting, for the time being, supporting that leg, that limb while it regains strength, giving that animal confidence to bear weight, medical acupuncture and related techniques for all of the above that we were just talking about, deactivating trigger points, increasing proprioception from places like this pes anserinus. So for the vets, you'll know what this is, this confluence of tendons, the sartorius, gracilis, and semitendinosus that each have supplied by different nerves, the femoral the obturator and the tibial branch of the sciatic nerve. This is such a huge, super huge, important site that is conveying so many afferent signals to the brain and the spinal cord for proper integration of impulses and stiffening or relaxing of various muscles so that you can keep that joint, keep that knee joint where it is going to be stable and not overdo it. And this is that medial side of the human leg from my human book, Interactive Medical Acupuncture Anatomy. And here, what are they doing with a bone saw, this hardware with the TPLO? They're going right into that region and destroying those sensitive fibers. How can it become any more plain that you are just destroying all kinds of restorative opportunities for this animal's tissue? Why would we do that first, right out of the bat, as soon as possible, before the dog heals on their own and it was just a trigger point and it's better now? So people call me from various countries, and when they've seen my work and criticisms of the TPLO on the internet and say they're getting pressured. The intimidation tactics are so strong. And I just try to empower them with knowledge and say, read this, read that, go find somebody else to give you another opportunity. This is not an emergency. You don't need to rush because, again, many of them will turn around in just a few days. It wasn't a cruciate injury at all. It was something else, probably some kind of myofascial issue. So don't we want to know what your options are? Don't you want to know what your options are? Yes. So scientific integrative medicine and rehab as first-line care, that's my goal. That's where I want veterinary medicine to have its destiny, where we are making it kinder and more palatable and more effective and less traumatic and less fearful. So for those of you that do need to find a practitioner, if you go to curacore.org, so CURACORE.org, we have the medical side, which is the human side, and the veterinary side. You go to the veterinary side and you see this, find a practitioner. So if you're looking for somebody near you, this is where our acupuncture course grads are, and many of them are now signing up for the rehabilitation course. And we also have a PRIMA certification where you are fully fledged, fully imbued with all kinds of integrative approaches, and you know, in a scaffolded manner, you have the foundation of all the mechanisms of action, of how they work, and then you have that flexibility and that knowledge of how to apply acupuncture and medical massage and botanicals and rehab and laser therapy or LEDs for any condition, so that you have that empowerment yourself as a veterinary practitioner to utilize various modalities alone or in conjunction to bring to bear on all kinds of problems that animals may have, to thereby reduce reliance on medications and surgery. So as we say, no woo-woo, just science. So thank you for joining me. Thank you for sticking with me. Our website again is curacore.org/vet, which is the vet side. I don't have any questions waiting for me, but for those of you that are on the podcast, again, feel free to email me or call me, narda@curacore.org. And if you want the visual part, go to YouTube and you'll see the video for this. Okay, well, thank you, everybody. We'll delve more deeply into spinal cord injury next week. I hope to see you again. Thank you.